Disorders of the lymphatic system. The lymphatic system is a network of vessels that are going to transport lymph. Lymph is a watery substance from the plasma, and it transports it to the lymph nodes that trap, destroy, and remove infectious microorganisms, cellular debris, and cancer cells. Lymphedema is an accumulation of lymphatic fluid due to impaired lymph circulation. There's primary lymphedema, which is congenital, or secondary, that develops as a result of other disorders or removal of a cluster of lymph nodes. These clients may have swelling of an affected area. The skin can be very tight, firm, and in later stages shiny with brawny edema. We may see weeping or oozing. The tissue is very vulnerable to infection and injury. We're going to treat it symptomatically. Elevation always with edema, compression sleeves or stockings, and complex decongestive physiotherapy. Nurses need to be sure to assess the skin well, elevate, apply elastic garments. Mechanical devices might be necessary, in addition to emotional support and client education on skin care. So we have a woman undergoing a modified radical mastectomy who's at risk for ineffective tissue perfusion and lymphedema. A nursing intervention to prevent compromised flow of lymphatic fluid to the upper extremities includes what? This is B, supporting and elevating the arm on the side of the mastectomy. The characteristics of infectious mononucleosis include all of the following except, which we haven't talked about mononucleosis, but let's see if you can figure this one out. The incubation period is 10 to 14 days after exposure. So lymphomas. Lymphomas refer to a group of cancers that affect the lymph system. Hodgkin's disease produces enlargement of lymphoid tissue, the spleen, liver, with invasion to the bone marrow and the lungs. The cause is unknown, but the Epstein-Barr virus might cause mutations in some lymphocytes, creating malignant Reed-Sternberg cells. So these clients will have Reed-Sternberg cells in the lymph nodes, painless lymph node enlargement, epigastric pain or fullness, weight loss, anorexia, fatigue and weakness, low-grade fever, pruritus, night sweats, anemia, thrombocytopenia, and poor resistance to infection. We're going to diagnose with a CBC, blood chemistry tests, a CT scan, an MRI, a lymph angiography, and chest x-rays. We may do a laparotomy or a bone marrow aspiration or a biopsy, and then we stage it. It might be 1 to 4 and subclassified into A and B. We'll treat it with localized radiation, chemotherapy or those anti-neoplastic drugs, and antibiotics, transfusions, and potentially a stem cell transplant. Now, non-Hodgkin's lymphoma is malignant diseases that originate, again, in the lymph glands. It does have a genetic link with environmental triggers. It is classified as indolent, will have asymptomatic and it will be responsive to radiation or chemotherapy, or aggressive, and this has a shorter onset with acute symptoms. These clients have lymph node enlargement, and lymph node biopsies might be done along with additional tests for staging. We're going to treat with radiation and chemotherapy, immunotherapy, monoclonal antibody therapy. We may do bone marrow transplant, so we can do stem cell transplants or transplants from donors. Nurses need to educate and help take care of side effects of chemotherapy and radiation, and make sure to encourage extra fluid intake. Picture of the monoclonal antibody therapy. So we have a client diagnosed with Hodgkin's disease who's at risk for infection related to immunosuppression and drug or radiation therapy. To assist the client to remain free of infection, the nurse should implement which of the following? B. Restrict visitors from or with infections from contact with the client. A client with non-Hodgkin's disease is admitted to the hospital. In discussing the client's care with the nursing assistant, which nursing explanation is most correct in relation to the medical management of the disease? This is radiation and chemotherapy.